thank you guys for coming. My name is Dr. Nina Ford Johnson, and I'm a pediatrician at Infirmary Pediatrics. I have been in Mobile for now 10 years. I'm very glad to be here. I love it here, and I love taking care of children. It is the best job ever. I tell everyone that you can love on kids and watch them grow up and then give them back to you guys, and you guys do all the hard work. And so I thank you guys for doing all the hard work, especially you moms. I have a special place in my heart for all of you, and aunties and caregivers and everybody like that. That's so awesome. Hopefully you won't hear my children in the background, so I do apologize if you hear random crying, but hopefully it won't last long, okay? So Ashley's going to help us tonight, and we thank her from Infirmary for helping us with this presentation. So we'll go ahead and get started, and we'll move on to the next slide. So it's so important that we know the proper name of body parts, because girls, I want to let you know, if somebody touches you in your private area, you have to call it exactly what it is, okay? So if you could, guys, do me a favor in the chat or say it out loud. What are some of the names that people have called or you've heard referred your vagina as something else, okay? For example, I've heard of pocketbook and I've heard of secret. That's not the correct name, okay? So what are some names that you guys have heard of? If you want to say it out loud or type it, that's totally fine in the chat, and we'll give you a couple seconds to do that. Yes. Little girl. Someone says we call it little girl. Okay. What else? The no-no square. Oh, yes. Okay. Very good. Very good, Madison. Okay. Yep. And so I've heard of secrets. I've heard of tootie, but we're not going to call it that. We are going to call it vagina. That's our private area. Somebody called it honey. Okay. But JJ. But we're going to call it vagina, and then we're going to call our breast. We're going to call it breast because that's what it is. Okay. Now, males also have body parts. They have private areas too. Okay. And we don't call their private area. We don't call it. I've heard of a whole bunch of names. Okay. Wallets, tallywhack. So like I said before, we're going to call it the girl's vagina and the boy's penis, okay? So we'll move on to the next slide now that we know the proper name of our body parts. So puberty, what is it? Puberty is the physical changes and some emotional and mental changes that a child's body undergoes to get ready for sexual development in order to have a baby, okay? How does this happen for us girls? So it can happen. Puberty usually starts around age 8. Now, I've seen several of my girls have menstrual cycles that have begun at age 8. That's why we're talking about this now for our 8-year-olds. So it's so important that they know, because moms, believe it or not, they may not talk about it with you, but they're talking about it with their friends and they're hearing about it at school. So that's why it's so important to talk about this now, even at a young age. But breast development is only a concern. So that's the first stage that we see, breast development, and that usually happens at age 8. But breast development only happens as a concern if it's before the age of 7 for Caucasian girls and before the age of 6 for African-American girls. Now, African-American babies, girls usually start on their cycle about a year early than their Caucasian counterparts, okay? So that's when puberty development starts happening. It usually starts around age 8 and sometimes a little younger. So that's why it's so important that we see have our annual checkups with our doctors, and I'll explain more as we go on. So we'll move on to the next slide so we can talk about our first stage of development, and that's breast development. Again, I said it usually occurs around age 8. Now, don't be surprised that if one breast is bigger than the other, that's totally normal, okay? And as your breast starts growing and developing, it may hurt a little bit. And that's quite okay. Again, that is normal. There are normal lumps that develop under each nipple in the breast as it gets, as the breasts are developing. So if you're concerned, if there's a concern about being self-conscious as the breast starts developing our young girls, don't hesitate to start buying them a training bra, earlier, because that can also help with discomfort that may happen with that breast pain, and also with the shape of it and the look of it, as they're wearing their clothes. So loose fitting clothing can help, and also starting to wear a training bra at that stage. And we'll move on to the next slide, because now we're going to talk about our second stage of development, and that's pubic hair. Okay, so first it's soft and straight, and then it becomes coarse, thick, and curlier. Now, 10 to 15% of girls will have pubic hair development before breast development. And that's that can happen. I've even seen infant girls with pubic hair before too. I just have to make sure that the other stages of development hasn't occurred before the pubic hair development. Let's see. And so the pubic hair will continue to grow, and then it will spread to the inner thighs, okay? And there's a certain thing that us physicians, when we look at our children during our checkup, is we kind of stage where they are on their breast development and their pubic hair development, because that lets me know kind of where they are in terms of pubertal growth and development. Okay, and so we'll move on to the next slide, because then we'll have our third stage. And our third stage is underarm, or underarm hair, or armpits, or axillary hair, okay? And this occurs 2 years after we see pubic hair development. And this is the very last stage that occurs. So that's why it's important when I see them for their checkups, I'll have my girls, I'll say, raise your arms so I can look at their underarms and see where they are. And I notice that if they have pubic hair, if they have breast development, and they're having underarm hair, then I know puberty is hitting very close, and will be the menstrual cycle will be occurring very soon. Okay, and we'll move to the next slide. This one's very important. So I want to talk to you guys about body shape. And your body, girls, are going to go through a lot of changes as you're going through puberty. Okay, and it's common to develop what we call baby fat around this stage of development. And that's where the fat collects around our stomachs. And don't worry, as you get older and as you mature, and as you hit puberty and taller and everything, that will change. But I want you to know that every shape that you are in, that you are very beautiful, regardless of what you look like. Okay. I just hit 40, and I'm still talking about losing weight. I'm like, I've been talking about losing weight for years. Like, does it ever go away? So body image is so important, even at this stage. And that's something that I want to preach and tell you guys, that you are beautiful just as how God made you. Okay. So let's talk about what's really important. I think that majority of us are here on tonight, and that is talking about our menstrual cycles. And we'll move on to the next slide for that. Yeah, this is also known as your period, or that's usually what I try to call it when I see my girls at the office, period, or menstrual cycles, or something like that. Now, this usually happens about 1.5 to 3 years after the breast development. So we talked about looking at the different stages. We're looking at our breast development, pubic hair, our underarm hair. So then, I apologize, I hear my kids in the background. So after looking at all those stages, that's when I determine when their menstrual cycle will take place, or try to determine. Now, another question I ask is, when did mom start her menstrual cycle? Because sometimes that's what determines when a girl will start their own. Now, every woman will likely remember the first time they've had their period. I think I was in 6th grade at Lincoln Middle School, and that's when I started my cycle. So, that's a fun time. Well, not really fun, but challenging, and can be scary, but that's why we're preparing our kids. And so that's why it's important that I ask mom, and then I mirror that based on what the child's growth and development looks like. And that can give me a ballpark figure on when their cycle will begin. All right, we'll move on to the next one. So here's a picture of what a female organ looks like. Female organs look like. And Ashley, can they see my arrow?
No, they can't.
Okay. So if you look at it, there are two little pink circles. That's great. That's where we'll start off. There's two little pink circles, one on each side, okay? And that is what we call ovaries, all right? And ovaries is where we house our eggs. And eggs make one half of a baby. Every little girl who's born are born with their eggs, and they'll have those eggs for the rest of their life, okay? But as puberty and as menstruation starts to happen, what happens is each month, one of those eggs gets released from those little circles called ovaries, and it goes down that little tube. And those are called fallopian tubes, right? And from the fallopian tubes, it hits that first big thing, that pink thing. I'm sorry, I don't have my, I wish I could circle it, but I'm not that technically savvy. But it deposits at the uterus, and your mom can possibly show, yep, that's it, perfect. It deposits right in there, okay? And if it doesn't meet, and if you guys want to, moms, if you want to mute at this conversation, because I may say some things. So one half of a baby comes from a girl, and the other half of a baby comes from a boy, right? And so it's something called what is called sexual intercourse. And so the boy's penis, remember we talked about what the proper names are. The boy's penis goes into the vagina, right? And something is excreted called semen or sperm. And that sperm it matches up with one of those eggs. But say if that does not happen, of course, we would love for you guys to wait until you're married. And I tell my kids, have a boyfriend after law school or medical school. But so if a girl does not have sex, what happens is that egg and the lining of that uterus that we just circled, it sheds, okay? And it goes down the vagina. And when it sheds, it's actually bleeding. And that's what's called a cycle. So a cycle is what the egg kind of goes through, and the shedding of the lining of that uterus and how it goes through the vagina. So it's something that happens usually every month, okay? Now, a menstrual cycle usually happens every 3 to 5 weeks, usually every month. And the blood flow will be anywhere between 3 to 7 days, depending. Now, there are irregular cycles versus regular cycles. You know, like I said, a regular cycle usually happens every month. But in the first 1 to 2 years of a girl starting their cycle, it can be totally off. You can have a period in March and may not have another one until September. So it's very, very important to track your cycles, to write them down, to get the app on your phone and to keep track of it, okay? Because a lot of times when a girl has started their cycle, especially when they're middle school, high school, I'm going to ask them, well, when was your last cycle, okay? Don't look to your mom or anyone else, because now you are of age and able to keep track of that yourself. So it's very important to keep track of those things, okay? Let's see. I think we can go to the next slide. Okay, so we've covered that. Now, what are some symptoms that can happen when you're going through your cycle? Okay, so right before a girl to even first have a cycle, you may notice some white stuff in your underwear, okay? That's totally normal. It's thicker, it's a little white, but it doesn't smell and it does not itch. Now that is normal. That is something that is going to happen. And it may even happen before each time you have a period every month or so, okay? Your breast may become a little painful, or there'll be a little lumpy. And so that's normal too. Your stomach may start cramping. You may feel nauseated, like you want to throw up, or you may throw up. You may have lower abdominal cramps or stomach aches, okay, towards the bottom of your belly. And depending on where your uterus sits, you may even have back pain. So the majority of uterus, the muscle where the egg attaches, right? After it leaves the fallopian tubes, your uterus usually sits up and it faces towards your stomach. So that's why you have those stomach cramps. But occasionally, about 10 to 15% of women, and I'm one of those women, the uterus sits back. So instead of me having stomach cramps, I usually have back pain. And so that could be another symptom for you. Another thing are headaches. Okay. I'm not sure, but every time I have I get on my cycle, I have, okay, let me see. April, can you hear me? Is that better? I'll make sure everybody can hear me. Okay, so hopefully that helps. And I'll see if I can talk louder too. Let's see. So yes, headaches. And I'm not sure why I have headaches every time I have my cycle, but I do. So that's another part that can happen along with having your cycles, is having headaches, okay? And we'll move on to the next slide. So what can we do to help ourselves during this month, during the time we have our cycles? Another thing is you want to rest. So that's so important. Sleep is so key. You have to get at least 8 to 10 hours of sleep at night. Proper rest, even when you're on your cycle or not on your cycle, is very necessary. Okay. And so, and I tell my kids who have issues sleeping at night, may want to get rid of the phone at a certain time, or no TV in the room, or wind down at about 7 o'clock. So by 8, 9 o'clock, you're ready to go to bed. Drink your water. That is so important. So I'll show you my little gallon of water. And this is what I drink every day, because 80% of blood is made up of what? Of water. And so we have to make sure we replenish ourselves, okay? Exercise, that's still important, because our uterus is a muscle. And so muscles have to be worked out and they have to get proper blood flow. And that happens when you exercise. Your uterus is also a muscle. So Tylenol doesn't really work well, or caffeine, like an Excedrin or something, does not really help with uterus, or like when your stomach cramps because of your cycle, or your back hurts because of that, or a headache. That's why I like ibuprofen, because it's an anti-inflammatory and it works best against the uterus, which is a muscle. A heating pad works great on your stomach or on your back. And then you want to eat iron-rich foods, okay? Because sometimes, girls, our cycles can be really, really heavy, okay? And then we know that iron is in blood. So each month when we lose our cycle, we can become iron deficient. So we need to replace that. So iron-rich foods are so important. And those are usually found in our healthy foods, lean meats and things like that. Okay, excellent. So hygiene. So it's important. We talked about this today with some of my patients. We must take a bath and shower every single day, when we're on our cycle and we're not on our cycle, okay? Our body emits all different odors, and when our hormones and everything are increased because we're having our menstrual cycles and going through puberty, it can cause us to sweat more, and then that can cause us to smell more. So we must take a bath or shower every single day. And I like bathing with a sensitive soap, especially for my girls. Don't use that Bath and Body Works, that Victoria's Secret, those bath bombs. Leave those alone, especially on your private area, okay? And excuse me, I don't have a stock or money in Dove, I don't think, but I promote Dove because I like it. So I like Dove for sensitive skin soap. I think that's very, very good. I tell it for my babies, and I like it for my kids as well, especially going through puberty. Now, shaving, you may want to start doing that, okay? Especially as the hair gets underneath your arms, or on your vagina or private area, or even on your legs. You must use a disposable straight razor in one solid motion that goes up to down, okay? You want to bathe first in that area because you want the hair and skin around it clean and ready to use, and ready so it'll be able to shave better. And this is whether you're shaving your arms or underarms or private area. And it's good to exfoliate as well with good lather of that sensitive skin, either soap or like a shaving gel. And then after you shave, especially to prevent razor bumps on the private area, you want to use like a good oil. And I like my favorite oil for skin is olive oil. It's what you cook with. It's good for the scalp. It's good to moisturize your skin, but it's also good after you shave because that helps prevent razor bumps. And sometimes those bumps can get itchy. So I tell parents just to get a little bit of hydrocortisone ointment. I like ointment better than cream. Just because it moisturizes better. And you can use that for a couple of days after you shave. Deodorant, I like the Dove for sensitive skin kind, not scented. I even have children as young as 3 who are starting to smell and get a little musty. So I like that deodorant because it works well against the skin. It doesn't put forth an odor and the children aren't irritated by it. And cotton underwear only, no spandex. Okay, a lot of our girls, we dance, we're athletes, we're so busy leading busy lives, but the spandex and all the other kind of underwear can cause a lot of yeast infections, right? So that's where the vagina and private area can get really irritated and red and cause a lot of symptoms. And so especially if you're active and you're physically fit and you're exercising or you're dancing, it may be good to bring a change of underwear to school. So you can change a couple of times or at least once a day at school just to kind of keep everything fresh. Okay, very good. So now I'm going to give you a little example of like feminine products demonstration. Okay, if let's see if we can show me on the screen. So I think it's important, girls, when you are going to school, take a little makeup bag with you. So nobody will know what's in your makeup bag. They think you're going to the bathroom and putting on your makeup. But you can actually carry like an extra pair of underwear or some wet wipes or a little pack of deodorant or something like that to refresh yourself. So here's an example of a pad. And this is what some women use. And it helps to, this is what you put in your underwear. And there's like so many different products out there. I'm just going to talk about 2 today. The 2 main ones. Okay. There's a cup that some people are using. There's period panties out there where you don't use this, but this is an option. So this is what this is. It's a pad and you put it on your underwear. Okay. And you want to change your underwear, change your pad about every 3 to 4 hours. Okay. So that helps. Another thing, and these are not flushable. Okay. Usually you just wrap them up after you use it and you can kind of close it within the wrapper or the old wrapper that it came with, and then you throw it away. Another thing that usually is this for my older girls, and this is called a tampon, okay? And it comes in these little plastic wrappers. Like so, okay? And you see the little string here. And so what you do is it pushes up. This goes into the vagina, it pushes up, and then this falls out. So this does not stay inside. This goes in the trash can, okay? And then this is left inside. And this is cotton, so it expands and it soaks up the blood. This little string though, this is what hangs out of the vagina. And so this is what you push out or pull out. Okay, so this doesn't last long in the vagina. This stays maybe 4 hours, if that. I don't recommend this is to be worn overnight, okay? But say if a girl is swimming or going to the water park or something like that, then this would be something that could work for them. I prefer this to happen in usually my teenage girls, usually ones who are quote unquote active, if you know what I mean. Okay, so I think that's all I have, and I think that basically covers everything. I just wanted to give you guys just a gist of what to expect, and to just start the conversation, right? Just to plant the seed. And so ask those questions to your mom, to your caregivers, your grandmothers, your aunts, even, your teachers, your female teachers, because they've been through it too. And, if you happen to have something like, an accident at school, or you come on your cycle at school, don't hesitate to even ask the school nurse if you can use the nurse bathroom, because some kids are not comfortable in using the regular bathrooms that all the other kids go to.